everybody, welcome to my channel. My name is Tori Brame. I am going to talk to you guys today about pediatric lupus because I had that, and yeah, if you want to know the symptoms, stay tuned. So in case you haven't noticed, I started batching these videos, which I always batched them, where I would film like 2 or 3 at a time, and I just stopped trying to fool you guys that I wasn't, because I used to change the background, I used to change my hair and my shirt. Now I don't care enough to do that. If you guys are watching the video, chances are you didn't watch the video from last week, because I have a ton of new viewers and very few returning viewers. So if you're a returning viewer, thank you so much for hanging out. Thank you for staying loyal. I don't know. I mean, you can watch it. Anyway, thank you for coming back. So today I want to talk about juvenile or pediatric lupus. I've seen it both. I don't know which one is the correct one. And then there's one that only applies to like a baby with lupus. So I don't know. Yeah, I'm gonna put both labels on this, and if you search it and find this, then I hope you're in the right place. So I went back and watched my video on juvenile lupus before, and I was gonna just completely redo it, but looking at it, it actually really wasn't that bad for not having any kind of editing equipment or a tripod or anything like that. I did it on my phone in my old living room with my phone balanced against a chair. So that, you know, we all gotta start somewhere. So in this video, I mainly wanna focus on the symptoms of it. These are things you can look out for in your kids, or you can think back to your childhood and see if they were precursors to a flare that got you diagnosed. It's basically just gonna be a list. So let's get started. The first one was rashes. I struggled with rashes for so long. They were often called eczema by healthcare providers, but they didn't follow the pattern of eczema. Like they were really sporadic and they would come and go. And I had several people say that it wasn't eczema, it was a different type of rash. I did not have the molar rash, the butterfly rash, but I did have rashes all over my hands, and usually in the creases, like in my elbow and then behind my knees, I had really terrible rashes. They were intensely deep. They would make my skin swell, crack, and bleed. I also experienced a lot of joint pain underneath those rashes. So if I had rashes on my hands, it was hard for me to like even curve my fingers. Very early in childhood, I experienced joint pain, and I, was a rough and tumble kid, so everybody just kind of attributed it to getting hurt. However, I was not getting hurt. They were minor flares. And I know that because I would think back really, really hard to everything that I had done the day before, and there was nothing. There was nothing that it could have been. I really do attribute those to flares. I would also get other phantom, I don't even know, inflammation spots where they wouldn't necessarily be on a joint or on a tendon. Sometimes I had them on a tendon, but they would just be like kind of part of the muscle or something, where they would be red and swollen and really hurt. And nobody hit me or anything. There was, it was just there and just pop up. Speaking of swollen tendons, I would get inflammation on my tendons, which sucked. But there was this tendon right here was a really popular one for my body, and it would just swell really bad. It was hard for me to write. I would put my hand down on a surface to write, and it was just extremely painful. And then I would also get the tendon right here that would swell, and it would make this finger curl up, and I was unable to get it up. Like I would try hot water, cold water, everything, and I would try, just like trying to pull on it up, and it was just absolutely excruciating. It felt like the tendon was gonna snap if I pulled it too far. I remember having mouth ulcers all the time. Like I always had a canker, is what we called it when I was growing up, where it was just like on your tongue. I would also have them on the inside of my cheek. I just always felt like I got them more than most people. Like I would ask, hey, do you ever get these? And people would be like, oh yeah, I get them sometimes. And so I would kind of chalk it up as normal, but I remember having them all the time as a kid. it's really hard for me to remember a time when I did not have knee trouble. That was the main culprit for most of my childhood and teen years, was just my knees would hurt. It was hard for me to bend them. My knees always sound like Rice Krispies when I stand up, just snap, crackle, pop. It was always something that was really prominent for me. When I was probably 14, I had pleurisy. So that's when the lining of your lung becomes inflamed and it is hard to breathe and it feels like somebody's stabbing you with every breath. That was extremely sudden. I was babysitting a little girl that I used to babysit, and my mom pulled up and I really felt like I had a cramp in my back or something, and I was like, wow, this really hurts. Well, that lasted for a week and a half. It was hard to breathe. I couldn't sit in certain positions without it feeling like my lungs were being crushed. I didn't go to a doctor for it. My parents didn't have health insurance, I don't think. Anyway, my mom knew a lot of medical people who were able to guess that it was pleurisy, and so I just took a bunch of ibuprofen and it went away after about a week. But I remember, a lot of nights where I was not able to sleep because the pain was so bad. I also had chronic anemia where I was lethargic. If you do like the anemia test to see, I'm kind of anemic now, yeah, it tracks. To see like if the white spot like fills in. I had that all the time. My mom would check me for it sometimes and she would just be like, yeah, you're anemic, here, take some iron or something like that. And I didn't have a point where I wasn't anemic, which of course is one of the signs of lupus. I also had some bad flares in high school. I think a lot of that was just high school stress, not sleeping enough, stuff like that. I also had mono in high school, and so I think that was like maybe sister to a flare. I have cats messing down here at my feet, like messing with my background. Hang on. All right, that should be okay. So yeah, I had pretty bad flares in high school. There was one time where I was actually playing on the varsity basketball team. I was so excited to, it was like a real status thing for me. Like I was really excited, and my hip stopped working. Like I was in so much pain. I had like shooting pain down the side of my hip, and it was like the joint itself was tender to touch. And so I ended up just like being the, team manager or whatever, where I was like on the team, I would go to the games, but I wasn't able to play. And so that really sucked. And I was like limping all over high school. And so that was another thing that it was so textbook lupus, like hindsight is 2020. And so that was what that was. But another really big thing was depression. That's not normal for kids to have depression like that. And, I think my personality is predisposed to be more melancholy, but straight up depression, that was not normal. The things that hurt me the most were people thinking that I was faking it. I was faking pain. I was trying to get out of things that I didn't want to do. Also, like the just snap out of it, like if people knew how badly I wanted to just snap out of it, would have changed everything, I think. So if you are Googling this and you find this video and you think maybe, you in your past, or you yourself now, or your child has pediatric lupus, definitely go talk to a doctor about it. That was one thing that, we, as a family, we were more the all-natural, anti-vaxxing, go to all-natural homeopaths that don't even take insurance type. And so I did not have the kind of care that could kind of look at it like that. It was also like 30 years ago, so like research for lupus was not as good as it is now and stuff like that. So even if I had been to like a really great healthcare provider or something like that, who knows if they would have caught it, honestly. But I can say this as a parent now. We like to think we really know our kids, but we don't always. And so they're always trying to tell us who they are. And so if we really stop and listen and not just, take the evidence that we think we see, I think it could go a long way. So if you have somebody close to you, a kid, a niece, a nephew, anybody who's going through this and think they might be faking it when they're in pain, or they have headaches, or they're just like really tired when nobody else is tired, or they're struggling with depression at a very young age or something like that, really pay attention, listen to them. Don't just sweep it under the rug as a bad attitude, or they're trying to get out of things or stuff like that, because you can be very young and healthy and have a lot of stuff going on that it's honestly just hard to catch. So I'm just going to leave you guys with that. Leave comments below if you have anything to add to the conversation, or if you guys have any questions. I don't know how much I can answer. I'm not a doctor. I actually thought about doing a whole separate video that's like, I am not a doctor, because the royal we, me, myself, I get a lot of questions asking about medications, symptoms, like, what do I do questions and stuff like that. And I'm always like, talk to your doctor, because they are the ones who know you. They know your history, they know your chart, everything like that. I can help you brainstorm, but I'm not going to tell you what to do other than go talk to your doctor. So yeah, that's all I have for you guys, and I hope to talk to you later. Bye.